Okay, I'm laying around for a while.
Yeah, well, I appreciate it.
Yeah, we're here today to take drug take-back. We try to do this at different locations throughout the county when there's events like this to try to get our prescription drugs off the street. Prescription drugs is the #1 issue among our young kids, and that's 12 to 14-year-olds. Getting the prescription drugs from their parents and grandparents' cabinets. So if you have leftover drugs laying around, we need you to drop them off either at the Barron County Sheriff's Department or the Rice Lake PD, 24/7, 365. No questions asked. You just drop them off in our, looks like a library return book drop, and throw them in there, and we dispose of them during our DEA drug take-back days, usually at the end of April and the end of October.
Hi, I'm Kim Gogan from the Aging and Disability Resource Center, Barron, Rusk, and Washburn County. We decided to do the Independence Your Way event because we wanted an event that would showcase the services that our agency can provide to the aged and disabled of Barron, Rusk, and Washburn County. And we wanted to do an open house so people could stop in and be relaxed and we could talk one-on-one with people. And we also partner with some of the people that we have referrals to, like Center for Independent Living, so we wanted them to be at the event too to showcase what they can do for people as well. So we decided to have it right around Independence Day because what we do is try to help people remain independent in their home. So there's different services that can help people remain independent in their home and can help save money by remaining independent in their home.
For as long as possible.
For as long as possible. And then we can also talk about the different options if somebody can't remain in their home, how they can still remain as independent as possible in a different setting, living situation.
Hi, my name is Denise Weston. I work for the Center for Independent Living here in the Rice Lake Hub office. The Center for Independent Living is a nonprofit agency that works with individuals with disabilities. Our mission for the center is to advocate for and with persons with a disability to exercise their right to fully participate in society. So we offer 4 core services of peer support, information on disabilities and referrals to other agencies, independent living skills training, and advocacy. That can be advocacy on an individual level or a legislative level, whether it be city related, state related, or national or federal related. Part of our independent living services, we have a lot of assistive technology or adaptive equipment that individuals can try to help with their independence. So we work with a lot of individuals maybe with some hearing loss, and so we have amplified telephones, but also
lighted amplified telephone.
Yes, it will light up when the phone is ringing, but also our phones have large buttons for those with vision impairment. We have alerting devices to let you know in other rooms of the house that your phone is ringing or someone is at the front door ringing your doorbell. And there is some funding from the TEP program to help pay for the phone landline equipment. Okay, so in addition to adaptive equipment for vision loss, hearing loss, we also have a lot of equipment that people can try for like mobility. Right here I have set up vehicle aids. So this is a swivel seat that someone could sit on to aid them getting in and out of their vehicle, so it does swivel. It's just to help you get turned around so you can get in and out of the vehicle. Aids, these are also aids for getting in and out of your vehicle, whether you're pushing yourself up or pulling yourself up. Gas caps, this goes on the seat belt so you don't have to reach so far back to pull the seat belt around your waist. a mirror that's extended your view. Here I have some ergonomic gardening tools for those with maybe some arthritis. Down here I have some vision aids. This is a low vision keyboard. This is an electronic magnifier that you can take with you, a portable one.
That's cool.
Yeah. A large button, remote control. And we have quite a few talking devices, such as talking watches, and this is a talking clock and temperature. And this is just a sampling of some of the equipment that we have. And if you're interested in any of these services, there is no charge for us to come and visit you and for you to try the equipment. We do not sell any equipment. If you find something that works for you, we help you find where you may purchase the items. So if you're interested in these services, just give us a call, 1-800-228-3287, or you can contact us on our website at cilww.com. Thank you.
Hi, I'm Thompson, and I'm with the state of Wisconsin with the Office for the Blind and Visually Impaired. And I've been with the program 21 years now. Our mission of our program is to help and assist individuals with vision loss or blindness to develop the confidence by teaching the adaptive skills necessary, teaching the assistive devices available and technology that's available, and other resources and programs to help the individual to maximize one's independence and improve their quality of life in the home and in the community as well. We have 13 rehab specialists spread out throughout the state, and my office is based in Eau Claire. And we cover all 72 counties, and we work with adults 18 years of age and older. Our primary consumers are older adults 55 and older. And when I started 21 years ago, the average age was around 70, 75. Now it's phenomenal. It's around 90, 95 and older. So when I receive a referral, and some of our referral sources include the ADRC office, the benefit specialist, the VA, the eye clinics. We work right in the home. So wherever the individual should be residing, whether it's in their own home, assisted living, retirement, the nursing home, and I've even went into correctional facilities, and I've even worked with homeless individuals. And we go through a functional assessment of the difficulties that the individual is having based on their vision loss or blindness. And the daily living areas include the area of low vision, communication skills, meal preparation needs, personal management needs, home management needs, leisure time activities, orientation and mobility, learning how to use the long white cane, and we're also a community resource provider. And then we assess those needs and work on those needs to teach the individual the different adaptive skills and how to manage and maintain their independence in the home and in the community as well too.
Hello, my name is Shaunee Thomas. I'm the deaf and hard of hearing specialist with the Office for the Deaf and Hard of Hearing. My office is based out of Wausau, and I'm here today in Barron County. It's my first time at this event, and there's a good number of people here. And this is hosted by ADRC, the Aging and Disability Resource Center, and they have invited me to come in. We've got promotional materials, resources, things about hearing aids and interpreters and CART. So we've got lists of things. We've got financial information for assistance for people who are getting hearing aids. We've got information for deaf and hard of hearing people. We've got information about the Americans with Disabilities Act, information about service animals, hearing loss in hospital settings. We have other brochures, various things that you can take with you. I serve 27 counties in north and western Wisconsin. I serve people who are deaf, hard of hearing, deaf, blind from birth to death. Hi.
Hi there, my name is Rekha Bulk and I'm with Be Well Barron County. I am the grant administrator. Be Well Barron County is a countywide program that's funded through the Healthier Wisconsin Partnership Program in the Medical College of Wisconsin. So we work to reduce obesity rates in Barron County by increasing physical activity levels and healthy eating habits. And we do that a variety of ways. We work with work sites. We have a countywide worksite wellness program that any worksite in the county can get involved in. We work with healthcare systems. We work with schools and other different community sectors, so such as restaurants, grocery stores, and faith-based communities. And we also partake in a lot of different community health fairs and events, such as the Independence Yearway event. We also offer a lot of really great resources. So we just came out with the Be Well Barron County Eat Well with Be Well cookbook. It has a ton of great healthy recipes in there. We also have the Be Well Barron County Physical Activity Guide, which shows all of the different places that you can go in Barron County to be active. So these are just a few of the things that we offer. We also partner with a lot of different community sectors and also government sectors on different committees to try to increase physical activity levels and healthy eating habits. And we're just hoping to make residents become more aware of their health and lead healthier, happier lives.
And it's never too late to get fit.
It is never too late to get fit.
Hi, I'm Jennifer Jaco. I'm a registered dietitian for the Elderly Nutrition Program in Barron County. And today I just wanted to share that we are talking about our Beneficial Bites program in Barron County. What this program is each month we choose some type of fruit, vegetable, spice, something healthy to talk about, and to teach anybody of any age about the nutritional value of that fruit or vegetable. So we do presentations throughout Barron County. Rice Lake, we have the 4th Wednesday of every month. Chautauqua is the 3rd Thursday of every month. Cameron is the 2nd Tuesday of every month. And Barron is also the 2nd Tuesday of every month. And we do those at the senior centers in each community. And again, we just do a presentation about that food and what the health benefits are. And then we've got food samples using that food, and then recipes for you to take home. So it's a great chance to socialize with other people, try new foods, and then just learn about healthy eating.
Good afternoon, I'm Peggy Schmidt and I am the Dementia Care Specialist for Barron County. I work for the Office on Aging, which is a part of the Aging and Disability Resource Center. And the programs that I promote are the Daybreak, which is our adult day program. And we offer this program Mondays and Fridays at the First United Methodist Church in Barron, and on Wednesdays at the Rice Lake Senior Center in Rice Lake. And this is a program for older adults with memory changes. And the big part about our program is the socialization and the activity. Another benefit that's aside is the respite that caregivers get when their family members are attending Daybreak. But in Daybreak itself, we start with a little bit of socialization at 9 o'clock in the morning till about 9:30, and then we move on to our current events or our brain health section, where we work on memory and being able to recognize what's going on in current events. At 10 o'clock, we have some type of a chair activity, physical exercise program. 11 o'clock, we have our Melodies and Memories program. We have people that come in and play piano, and we sing. At usually 11:30, quarter to 12, we have our lunch time. And from quarter after 12, we have either some type of an activity. We have some people coming to do crafts with our participants. Sometimes we do a activity where we'll go here in Rice Lake. We go down to the lake to see the ducks and the geese and who's on the water and if they're catching anything. And if it's a really nice day, we'll do a little tour of the Veterans Park down there. And we usually come back and have another snack. Our day ends at 2 o'clock. One of the nice things about Daybreak is that we do provide transportation if that's needed. Sometimes family members will bring their loved one to the program. So
old, it's hundreds of years old, but it's not the really ancient thing. The really ancient thing is called Qigong. And if you go to a Tai Chi class, you're going to get a mixture of both. Tai Chi itself is the routine that they do. And so it's almost like a choreographed dance, where you have certain movements that you do in a certain order in a certain way. And if you see people like out in the park and they're all doing the same thing, they're all moving together through a series of things, that's Tai Chi that they're doing. But to have a class with just working on that, that could get a little bit hard to concentrate on for a long time. So Qigong is individual exercises that have been done for hundreds of years in the Eastern countries. And so I can show you some Qigong that's a little bit easier to learn. So let's do this first one. Someone had said this is the best exercise ever. I'm like, so this is not difficult, but you'll see how it's really relaxing when you do it. So what I want you to do is just stand up nice and take your hands and put them in front of you so that your fingertips are facing each other. Now we're going to inhale as we just let our hands arc out and overhead. And then we're going to exhale as we let them slowly drop down to our sides. Bring them back, and we'll do it again. Inhale. And exhale. So as you inhale out, feel a nice stretch in your torso. We'll do it once more. Just notice how relaxed you feel when you do it. So did you notice how when you bring your arms up, your lungs just naturally fill up because you're expanding your rib cage? So a lot of the Qigong things take advantage of that so that they slow down your breathing, because your breathing is sort of forced to match your movements. And so both Tai Chi and Qigong are really good because of that slow breathing that they encourage. So I thought what I would show you today are some warm-up exercises that you can do before a Tai Chi session, because to try to teach you a part of a Tai Chi routine is kind of pointless because you really need to learn the whole thing in order to do it. And it takes several weeks, probably 6 or 7 weeks to learn it, if you come once a week, to learn the Tai Chi routine. And if you want to do that, I teach it in Chitek at a couple places, so there's information up here on where I teach it in my card and so forth. But I can show you some of these exercises that are good to do. So before we start, we want to warm up the different parts of our body. So one thing we can do is warm up our neck. So in order to do that, put your hand up in front and look at your palm. And you want to just slowly bring your palm up to the side that it's on. Like if you're using your right palm, bring it to the right. Just gazing at your palm and then bring it back to the front. And then bring your other palm, your other hand up and go in the other direction. Just feel how that just gently twists your neck. Bring it back to the front. When you do it the second time, you can twist a little bit further. Keep concentrating on that point in the center of your palm. The practice of Tai Chi or Qigong can help increase focus as long as when you practice you really do focus on what you're doing. If you're letting your mind wander, then it's not going to improve your focus. Just concentrate on your hand, moving to the side. And there's a couple things we can do to loosen up our shoulders. One would be just a shoulder roll to the back. And just go nice and slow. Your arms relax. Our shoulders are actually meant to do this. Okay. All right, and then another one, this actually has a name. This is called thinking the chi. And the chi is the word that's referred to, that refers to the energy. So what we're doing is we're gathering the chi like this. Bend your arms, bring your hands overhead, and then sink the chi down to your center, which they believe is right below your belly button. Inhale. Bend your arms at the elbows. Down as you exhale. So that's a couple things to kind of loosen up your shoulders, and you can do these exercises independently if you're sitting around, you're feeling your shoulders are a little stiff. You just do a couple of things. Here's a couple that will stretch out your torso, and they're a little bit different than movements that we normally do. So this first one, you're going to be stretching one side, and you're going to be contracting on the other side. So hold your hands like you have a ball in your hands. Stretch this one, the top one up, and press down with the bottom. So this side is opening and this side is closing. Press down. And then bring them back. And open the other side and close the other side. Now you can either inhale or exhale, and then do the opposite here. So it doesn't really matter whether you inhale or exhale on the pressing motion, just so you do it the same every time, because either way you're going to be slowing it really down. Now there's another one we can do that twists at the waist. Again, we're going to be, this is called embracing the moon, but it's kind of like holding up volleyball. And this time we're going to turn our whole body to the side. When we get over here, switch your hands now, the other hand is on top. And actually, you're going to be leading with the top hand, so switch it like that. There you go. So this top one, that's the one that's sort of leading the way. And then switch. And go back. Just move really slowly when you switch your arms around. It's like they're going around the outside of this imaginary ball. Feel a nice twist in the way. Your ball is about the size of a beach ball. Keep your ball small. And back to the middle, okay. And then we have someone you can do the service.
Hi, I'm Mary. I work for the Aging and Disability Resource Center in Barron, and I'm here today at the Independence Your Way presenting information on advance directives. For a lot of people, you may not know what an advance directive is. Basically, it's you giving your family or friends an idea of what information you would like to include in your healthcare power of attorney and your financial power of attorney. Bottom line is, if something were to happen to you where you could not make a decision for yourself and you couldn't speak for yourself to let people know what you wanted, you either have to have something like this in place, power of attorney, or the system takes over and you end up with a guardianship. Guardianships are not free. They cost $2,500 to $3,000 these days, whereas everything you see on my table here is free. The forms are pretty much self-explanatory. There are people who can help you with filling these out. Your local hospital social worker would be glad to sit down and talk with you about advance directives and help you fill them out. Basically, it's just making sure that you've got someone in place to speak for you if you would ever need that to happen.
Hi, I'm Carrie from the Rice Lake Public Library, and I think that some services that the library can help with people who are aging is to get them out into their community so they can stay active and stay involved and know what's going on with other people. It just helps to be able to have a conversation with them and know what people are talking about. And some of the resources at the library can help with that. We have large print books, we have computer classes, courses that you can take. We have just adult programming that you can come and just mingle with other people of the same age and be out in the community and get to know people and stay active, because that's really important to stay healthy.
And you also have a very helpful staff, and that's from personal experience. So
thanks, Bruce.
You're welcome.
Hi, this is the Aging and Disability Resource Center. This is our Washburn office information. Aging and Disability Resource Center serves people 18 to 100 and whatever. We have disability benefit specialists that serve people 18 to 59 with disability issues, social security issues. We have elderly benefit specialists that help people who are 60 or older, help them with Medicare, social security, many other benefit issues. We also have information and assistance resource specialists who help people get into certain government in-home programs, long-term care. We provide resources, information as best we can to the residents of Barron, Rusk, and Washburn County. This is just some of the things that a resource center does and can help you with. And so if you need assistance, please come to the Aging and Disability Resource Center. There's one located in Barron, Rusk, and Washburn counties. But we are one resource center, but we serve 3 counties. So please come see us. We'd like to.